Strength duration curve, graphical relation between the pulse duration and a strength of a stimulus required to produce minimum contraction. It's a most satisfactory method. Definition of a SD curve. It is an electrodiagnostic procedure characterized by plotting a graph of the amount of intensity required against various duration of impulse so as to determine the status of innervation of muscles. It is also known as intensity time curve. Apparatus, a diagnostic muscle stimulus with a different duration of interrupted direct current 0.01, 0.03, 0.31, 3, 10, 1300, 300 millisecond with rectangular waveform. Stimulate with the constant voltage and or constant current can be used. Electrode, leads, graph paper, pencil, eraser, cotton swab, water, or a normal saline. Preparation of a patient. Explain the procedure in a brief to the patient. Position the patient in a comfortable position. Request to expose the area to be examined. Make sure that there is adequate light to see the visible contraction of the muscles. Application of a electrode. Secure the indifferent electrode at a convenient area, usually over the midline of the body or origin of a muscles, and active electrode over a motor point. Method of application of a current. Current is applied using the longest stimulus, first say 300 millisecond, and increased until the minimal visible contraction is obtained. The minimal contraction may be assessed visually or by palpating the tendon. Note the intensity of a current required to produce minimal contraction and then decrease the intensity to zero. Shorten the impulse, say now 100 millisecond, and increase intensity and note the current at which minimal contraction is obtained. Repeat this procedure for each length of a stimulus and put all intensity in this card. Drawing of a graph. After noting the current for various duration, alpha graph is plotted with a strength of current on a y-axis and pulse duration on x-axis. Characteristics of a SD curve. It is the shape of a curve which is important in determining the status of a muscle innervation. Fibers supplying the muscles are intact. The SD curve has the shape of a normal innervated muscles. This curve is of this typical shape because some strength of a stimulus is required to produce a response with all the impulses of a longer duration, while those of a shortened duration require an increase in a strength of a stimulus each time duration is reduced. The point at which the curve begins to rise is variable but is usually around 1 millisecond. Complete denervation. When all the nerve fibers have degenerated, a SD curve is produced is characteristic of a complete denervation. For all the impulse series with a duration of 100 millisecond or less, the strength of a stimulus must be increased each time the duration is reduced and no response is obtained to impulses of a very short duration, so curve rise steeply. Partial denervation. Where some of the nerve fibers supplying the muscles have degenerated while are intact, the characteristic curve obtained indicate partial denervation as the impulses are shortened in the denervated fiber response less radially, so that the stronger stimulus is required to produce a contraction and a curve rise steeply. With impulses of a shorter duration, the innervated fibers respond to a weaker stimulus than that required for denervated muscles, so contraction of a denervated fiber is not obtained, and this part of a curve is similar to that of innervated muscles. Thus, a kink is a seen and point where two sections meet. Denervation, denervated, normal, partial denervated. Advantage: simple, reliable, easy, cheaper, non invasive, and most widely used test. The difference in whether muscles is innervated or denervated. Less time consuming, can be used as a hand side method. Disadvantage: cannot localize the site of a lesion. Most reliable result obtained only from the superficial muscles but not from a deeper muscles. Differential diagnosis of a condition affecting the anterior horn cell and the nerve are not possible to obtain. In a large muscles only, proportions of a fibers may record so picture is not clearly shown. It is quantitative rather than the qualitative method testing the muscles innervation. Clinical use of ST curve in a diagnosis to detect the proportion of innervation in a muscles. If the muscles is completely or partially denervated, the shape of the curve will denote the extent and the size of the lesion. Thus, it is also used to assess the extent of a denervation. It will detect the sign of a renervation in the muscles. The chronic shear time can be measured from the ST curve. It will monitor the progression of a lesion and denote the lesion whether the lesion is recovering or regressing.